In this video, I start by telling viewers that the prostate is a small gland found only in men, but it plays a big role in their health. It sits just below the bladder, in front of the rectum, and wraps around the urethra, the tube that carries urine out of the body. The main job of the prostate is to produce a special fluid that mixes with sperm to make semen. As men get older, this small gland can start to change in size and shape, and that's when some common health problems begin. I explain that there are two major conditions that affect the prostate: benign prostatic hyperplasia, which we call BPH, and prostate cancer. Even though both involve the prostate getting bigger, they are very different in nature. BPH is a harmless, non-cancerous enlargement that usually happens with aging. It can cause problems with urination but is not life-threatening. Prostate cancer, on the other hand, happens when the cells in the prostate begin to grow out of control and form a tumor that can spread to other parts of the body. That's why it's so important to understand the difference between the two. Many men confuse them because their symptoms can seem similar, but one is manageable and the other can be deadly if not caught early. Then, I move on to explain how the prostate actually works and why these issues happen. I describe it as a walnut-sized gland that sits right below the bladder and surrounds the urethra like a ring. Because of this position, whenever the prostate grows bigger, whether due to age or disease, it starts pressing against the urethra, making it harder for urine to pass through. That's why men with prostate problems often notice a weak urine stream or the need to urinate more often, especially at night. I also talk about hormones, mainly testosterone and its stronger form, dihydrotestosterone, which play a big part in prostate growth. As men age, these hormones can trigger the gland to grow larger, which leads to BPH. But sometimes, due to DNA changes in the prostate cells, those cells begin to multiply uncontrollably, forming prostate cancer. I use visuals to show how in BPH, the growth is smooth and even, while in cancer, it's uneven and irregular. Both start from the same organ, but one is natural and the other is dangerous, so early awareness and medical checkups are key. In this part of the video, I start by explaining how both benign prostatic hyperplasia and prostate cancer affect the body through their symptoms. I tell viewers that when the prostate grows larger because of BPH, it slowly begins to press on the urethra, the tube that carries urine out of the body. This pressure makes it difficult for urine to pass, and that's why many men with BPH notice similar problems. They might find it hard to start urinating, their urine stream may be weak, or they may have to stop and start several times before they are done. Some men even feel like their bladder doesn't completely empty, so they have to go to the bathroom again and again, especially at night. These symptoms can be frustrating, but BPH itself is not dangerous. Then I explain how prostate cancer can look very similar at first, which is why many men confuse the two. In the early stages, prostate cancer may cause no symptoms at all. But as the tumor grows, it can cause the same issues: difficulty urinating, pain or burning, and sometimes blood in the urine or semen. I remind viewers that since both conditions can appear the same in the beginning, it's impossible to know the difference without seeing a doctor. The video shows through animations how a benign enlargement squeezes the urethra evenly from all sides, while a cancerous tumor grows unevenly, invading nearby tissues. This visual helps make it clear why both conditions can cause the same discomfort but come from very different causes. Then, I move on to explain how doctors find out which condition a patient actually has. The first step is a digital rectal exam, or DRE, where the doctor gently checks the prostate by feeling it through the rectum. I explain that if the prostate feels large but smooth, it's likely BPH, but if it feels hard or bumpy, that could be a sign of cancer. After that, a PSA blood test is done, which measures a special protein made by the prostate. Higher PSA levels can appear in both conditions, but very high levels usually mean the doctor will look more closely for cancer. I also describe how imaging tests like ultrasound and MRI can give doctors a clearer picture of the prostate's size and shape. If there's still doubt, a biopsy is done, where small tissue samples are taken and checked under a microscope to look for cancer cells. I end this section by explaining that diagnosis is a step-by-step process, combining all these tests to make sure doctors can tell the difference and choose the right treatment in time. In this part of the video, I explain how treatment for benign prostatic hyperplasia and prostate cancer is very different because one is a harmless condition and the other can be life-threatening. For men with BPH, treatment often starts with small lifestyle changes. I tell viewers that avoiding too much caffeine, alcohol, or drinking large amounts of fluid before bed can make a big difference. Some men are advised to urinate on a regular schedule to train their bladder. If these changes don't help, doctors can prescribe medicines. I describe how alpha blockers relax the muscles around the prostate and bladder, making it easier for urine to flow, while another type of medicine, called 5-alpha reductase inhibitors, helps shrink the prostate over time by changing hormone activity. The animation shows how the urethra opens more freely after these treatments. For men with more severe symptoms, I explain that surgery may be needed. The most common one is called TURP, or transurethral resection of the prostate, where the doctor removes extra tissue blocking the urethra. I reassure viewers that BPH treatments are usually very successful and that most men feel major relief afterward. When I shift to prostate cancer treatment, the tone becomes more serious. I explain that the treatment plan depends on how advanced the cancer is. For small, slow-growing cancers, doctors may choose active surveillance, meaning they keep a close watch on the patient with regular checkups instead of starting treatment right away. But if the cancer is spreading or aggressive, surgery might be required to remove the entire prostate, known as a prostatectomy. The video shows this procedure step by step, highlighting how surgeons try to protect nearby nerves that control bladder and sexual function. I also talk about radiation therapy, which uses high-energy beams to destroy cancer cells, and hormone therapy, which lowers testosterone levels to slow the cancer's growth. In more serious cases, chemotherapy may also be added. I emphasize that the best treatment depends on the stage of the disease and the patient's age and health. Finally, I conclude by reminding viewers that BPH is not cancer and does not turn into cancer, but both need attention because their symptoms can be similar. I tell them that early detection saves lives and that every man, especially those over 50, should talk to their doctor about prostate checkups. The message I give at the end is simple but powerful: take care of your health, stay aware, and never ignore early signs, because early action can make all the difference.